What if the blood pressure number your doctor just praised you for is actually the number that's putting you in danger? What if perfect is not the same as safe once you pass 70? Before we go any further, do me one small favor. Tap that like button right now, not for me, but as a promise to yourself that you'll finish this video and actually use what's in it. Then hit subscribe, because this channel exists to hand you the kind of information that usually stays locked inside medical journals. And if you know someone over 65, send them this video before you forget. It might matter more than anything else you share with them this year. Here's the truth: almost nobody explains clearly. Blood pressure is not one fixed thing. It is not a grade on a report card where lower always means better. It is a living, moving number that changes with your age, your posture, your hydration, the time of day, and even how well your body has adapted over decades. And yet most people, including plenty of well-meaning doctors, still treat it like a single test you either pass or fail. Let's start with something simple. Picture a bridge built for a busy highway. When it's brand new, the steel is flexible. It can bend slightly under heavy traffic without cracking. That's what your blood vessels are like in your 30s and 40s. They stretch, they recoil, they absorb the pressure of every heartbeat smoothly. A reading like 120/80 makes perfect sense for a system like that. But bridges age. After decades of traffic, the steel gets stiffer. It doesn't flex the same way anymore. If you tried to force that older bridge to handle exactly the same load, at exactly the same speed, the way it did when it was new, something would eventually give. Your arteries go through a very similar transformation. The walls thicken. They lose elasticity. The tiny built-in sensors that once told your body, ease up, pressure is getting high, or push a little more, pressure is dropping, become slower to respond. Even your kidneys and liver, the organs responsible for clearing medications out of your bloodstream, quietly lose efficiency with age. So when someone in their late 70s is told to hit the exact same blood pressure target as someone in their 40s, it's a bit like asking that aging bridge to carry brand new highway traffic. The system underneath has changed, even if the number on paper looks identical. This is where the real controversy begins, and it's bigger than most people realize. For years, the medical message was simple: lower blood pressure is always safer. Get it down, keep it down, the lower the better. But large studies following older adults for years started to reveal something that surprised even experienced researchers. When they compared groups of seniors with different average blood pressure levels, the people sitting in the too low range weren't necessarily the healthiest. In fact, some of them were falling more often, ending up in hospitals with kidney problems, and in certain analyses showing higher rates of death than the group with slightly elevated readings. Meanwhile, people with very high blood pressure, well above what's considered safe, still had the outcomes you'd expect: more strokes, more heart complications. So it's not that high blood pressure is suddenly fine. It's something more subtle and, frankly, more important. The risk doesn't fall in a straight line as blood pressure drops. It curves. Picture the letter U. Extremely high pressure sits on one side, dangerous. Extremely low pressure sits on the other side, also dangerous. And the safest zone sits at the bottom of that curve, which for many older adults is noticeably higher than the number printed on the poster in your doctor's waiting room. This single idea, that lower is not automatically safer once you're older, is probably the most important shift in thinking about blood pressure over the last decade. And it rarely gets explained in a way that actually makes sense to real people trying to manage their own health. Doctors themselves have been having this debate behind closed doors for years. Some hold firmly to the old advice: push the number down, no exceptions, no matter the age. Others, especially those who specialize in the care of older adults, have started pushing back, pointing out that a body in its 80s simply does not respond to medication the same way a body in its 40s does. Both sides are working from real evidence. The disagreement isn't about whether high blood pressure is dangerous. Everyone agrees it is. The disagreement is about where the finish line should actually sit once a person has crossed into their 70s, 80s, and beyond. And that disagreement matters enormously because it shapes how many pills someone ends up taking, how aggressively their dosage gets adjusted, and how their day-to-day energy and clarity might be affected. Let's talk about why this happens, because understanding the why will help you make sense of everything that follows. Your brain is an incredibly hungry organ. It weighs a small fraction of your total body weight, yet it demands a huge, disproportionate share of your blood flow every single minute. Unlike a muscle, which can tolerate a brief dip in blood supply without much complaint, your brain reacts almost instantly when its blood flow drops even slightly. Now imagine blood pressure medication pushing an older person's numbers down aggressively, chasing that textbook 120 target. On paper, the chart looks great, but underneath, the brain may be getting just barely enough blood flow to function, not enough to thrive. Some researchers describe this as the difference between a blackout and a brownout. The lights aren't going completely dark, but they're flickering. Thinking feels a little slower. Words are a little harder to find. Focus drifts more easily. Many people chalk this up to just getting older, when in some cases it may actually be a side effect of blood pressure, sitting lower than that particular body can comfortably handle. There's a second, more physical danger tied to pushing numbers too low, and it shows up the moment someone stands up. This is called orthostatic hypotension, and it is one of the most underappreciated risks in senior health. When you're lying down or sitting, blood settles more evenly through your body. The instant you stand, gravity pulls blood toward your legs, and your body needs to react fast, tightening blood vessels and speeding up your heart rate, just enough to keep blood flowing to your brain. In a younger body, this adjustment happens in a second or two, often without you even noticing. In an older body, especially one on blood pressure medication, that adjustment can be delayed. Blood pressure drops sharply the moment you rise, sometimes 20, 30, even 40 points in the top number. For a brief window, your brain is underfed. That's the gray out feeling many people describe. That moment where vision dims slightly, the room seems to tilt, and you have to grab the counter or a chair to steady yourself. This isn't just uncomfortable. It's one of the leading hidden causes of falls in people over 70, and falls at that age are not a small thing. A single fall can lead to a fracture, a hospital stay, and a chain reaction that affects someone's independence for the rest of their life. Now, here's something that deserves far more attention than it usually gets. The way your blood pressure behaves across 24 hours matters just as much as, and arguably more than, the single number recorded during a 10-minute doctor's visit. Blood pressure isn't static. It naturally rises and falls with your sleep cycle, your stress hormones, your activity, even your meals. For most people, it dips gently overnight and rises gradually in the morning as the body wakes up and prepares for the day. But in some older adults, especially those on medication that wears off overnight, this rhythm becomes exaggerated. Pressure can drop very low in the early morning hours, sometimes low enough to be genuinely risky while you're still asleep. Then, as your body releases stress hormones to wake you up, pressure can surge upward quickly, sometimes dramatically, within a short window after you open your eyes. This swing between a low overnight dip and a sharp morning rise is sometimes called blood pressure variability. And some research suggests that big swings like this may be just as meaningful for predicting stroke and heart problems as the average number itself. Think of it like weather. A place with a stable, mild climate rarely experiences disasters. A place that swings from freezing nights to scorching days puts far more strain on everything. Roads crack, pipes burst, structures wear out faster. Your blood vessels experience something similar. A steady, moderate pressure all day is gentler on your arteries than a pressure that swings wildly from very low to very high within a few hours, even if the average of those two numbers looks perfectly normal. This explains why a single blood pressure reading taken once, sitting calmly in a quiet office at 2 in the afternoon, tells you so little about what's actually happening in your body the other 23 hours and 50 minutes of the day. It's a snapshot of one calm moment, not a portrait of your real cardiovascular life. There's another layer to this that rarely gets mentioned, and it's worth sitting with for a moment. The simple act of sitting in a doctor's office can itself change your blood pressure reading. Some people feel a flicker of nervousness the moment they see a stethoscope or a blood pressure cuff, even if they don't consciously notice it, and that mild tension can nudge the reading upward. Doctors sometimes call this the white coat effect, and it's surprisingly common in older adults, occasionally adding 10, 15, even 20 points to a reading that would look completely different taken quietly at home on the couch. The opposite can happen too. Some people relax so much once they finally sit down after rushing to an appointment that their reading comes out lower than what their body experiences during a normal, active day. Either way, the office is not a neutral measuring ground. It's an environment with its own quiet influence on the number, which is yet another reason home tracking tells a more honest story than any single visit ever could. Let's pause here for a second, because I want to give you something useful before we go further. If any part of this is making you rethink what you thought you knew about your own numbers or loved ones' numbers, that's exactly the point of this video. Tap like right now if something just clicked for you. It helps this information reach more people who need to hear it, especially people who've been told a single number is the whole story when it isn't. And if you haven't subscribed yet, now's a good moment, because we're about to get into the practical part, the part you can actually use starting tonight. So what should blood pressure actually look like for older adults, if not that familiar 120/80? Let's talk ranges, but with an important caveat first. These are general patterns drawn from research on aging populations, not personal medical instructions. Your ideal number depends on your specific health history, your medications, your activity level, and conditions like diabetes, kidney disease, or heart disease. Think of these ranges as a starting point for a conversation with your doctor, not a rule carved in stone. For adults in their mid-60s to mid-70s who are otherwise healthy and reasonably active, research suggests a systolic number, that's the top number, somewhere between 130 and 140 tends to offer a solid balance. It's high enough to keep blood flowing well to the brain and kidneys, but low enough to protect the heart and blood vessels from long-term strain. For adults from their mid-70s into their mid-80s, that range often shifts slightly higher, closer to 135 to 145. At this stage, arteries have typically stiffened further, and the body's ability to adjust quickly to changes in position or activity has usually slowed down more. For adults past 85, or for anyone considered frail regardless of exact age, many geriatric specialists lean toward a slightly higher range still, sometimes 140 to 150. At this stage of life, preventing falls and preserving independence often carries more weight in the overall picture than squeezing the number down as far as possible. Now, the bottom number, the diastolic reading, deserves far more attention than it usually receives. This number reflects the pressure in your arteries during the brief pause between heartbeats, which is actually when your heart muscle receives its own blood supply. If that number drops too low, consistently below the 60s, your heart itself may be quietly shortchanged during its own recovery period. For most older adults, a diastolic reading somewhere between 70 and 85 tends to represent a healthier zone. If yours regularly sits in the 50s, that's worth flagging to your doctor, even if your top number looks perfectly fine. But here's the piece that ties everything together, the piece that matters more than any single range I just mentioned: stability. A person whose blood pressure sits steadily around 138/78 day after day, hour after hour, is generally in a safer position than someone whose numbers swing wildly between 110 and 170, depending on the time of day. Consistency is the hidden variable that rarely makes it onto a chart, yet it may matter just as much as the number itself. So how do you actually find out what your own pattern looks like, instead of relying on a single reading taken once every few months in a waiting room? This next part is genuinely one of the most useful things you can start doing tonight, and it costs almost nothing. Get yourself a simple home blood pressure monitor. Most pharmacies carry reliable ones at a very reasonable price, and you don't need anything fancy or connected to an app. Alongside it, grab a plain notebook. For the next 2 weeks, follow this simple pattern. Every morning, within about 30 minutes of waking up, before coffee and before any medication, sit quietly and take your blood pressure. Write down both numbers. This captures what your body is doing naturally, before anything external influences it, and it's especially useful for spotting that morning surge we talked about earlier. Every evening, around a similar time each day, take it again. This shows you how your medication, your meals, and your day's activity have shaped your numbers by the time evening arrives. Twice during those 2 weeks, pick 2 separate days, do a simple standing test, lie down flat, and rest quietly for about 5 minutes. Take your blood pressure while still lying down, then stand up and take it again right away. If the top number drops by more than about 20 points, or the bottom number drops by more than about 10, that's a sign of orthostatic hypotension. This is the same phenomenon behind that gray, dizzy feeling some people get when they stand up too fast. Write everything down as you go, including how you felt at each reading. Dizzy after standing? Note it. Foggy after lunch? Note it. Tired earlier than usual in the afternoon? Note it too. Numbers without context are easy to dismiss. Symptoms without numbers are easy to explain away. Together, they build a story that's far more convincing and far more useful than either one alone. Once you have 2 weeks of data like this, you're not walking into your next doctor's appointment with vague complaints or a single reading from a rushed 5-minute check. You're walking in with a clear pattern. Maybe your mornings run high and your evenings run low, suggesting your medication timing needs adjusting. Maybe you show a sharp drop every time you stand, suggesting your current target might be too aggressive for your body. Whatever the pattern turns out to be, it gives your doctor something far more valuable to work with than a single office snapshot. Quick pause, because this next part deserves your full attention. If you've made it this far, you clearly care about getting this right, either for yourself or for someone you love. So let's make a small deal. Comment the word tracking below right now, just so I know how many of you are actually planning to try the 2-week method we're about to walk through. It genuinely helps me know what to cover next. And while you're there, tap subscribe, because the next video digs into the exact medications and supplements that quietly affect these numbers, including a few popular ones that do far less than their marketing suggests. Let's bring this to life with a simple comparison, because 2 people can share the exact same blood pressure reading and need completely different treatment plans. Picture 2 people, both around 78, both showing the same reading at their last appointment, something like 150/86. The first person is generally healthy, walks regularly, has no major health conditions, and takes no medications at all. For this person, gentle lifestyle changes, a bit less salt, more potassium-rich foods like fruits and vegetables, regular movement, and better stress management might naturally bring that number down to something like 140/80, which for an active person of that age is considered a genuinely healthy range. No medication needed, no added risk introduced. The second person, despite showing the identical reading, has some kidney impairment and a history of heart issues. Pushing their number down aggressively toward 130 could actually reduce blood flow to kidneys that are already struggling, potentially making things worse rather than better. For this person, a more careful target, achieved slowly and monitored closely, respects the complexity of what's happening inside their body rather than chasing a number that looks good on paper but ignores their unique situation. Same age, same starting number, completely different paths forward. This is exactly why blanket targets applied to every older adult, regardless of their individual health picture, can do more harm than good. Real, thoughtful care means treating the person, not just the number. Now imagine these two people are actually married, sharing a home, sharing meals, and sitting across from the very same doctor at the very same appointment. It would be easy, almost tempting, for a busy clinic to hand them both the identical instruction sheet. Get below 130, take this dosage, come back in 3 months. On the surface, that feels efficient, but underneath, it quietly ignores everything that makes each of their bodies unique. This is precisely why bringing your own 2 weeks of data into the room changes the entire dynamic of that visit. It forces the conversation to become personal again instead of generic. Let's tie all of this together into something practical you can actually carry forward from this video. First, start tracking. Morning readings, evening readings, and 2 standing tests over the next 2 weeks. This alone will give you and your doctor more useful information than months of occasional office visits. Second, pay close attention to the gap between your morning and evening numbers. A large swing, something like 20 points or more in the top number, is worth discussing, since it may point to medication timing that needs fine-tuning. Third, track symptoms right alongside your numbers. Dizziness, fog, unusual tiredness, all of it matters. And all of it becomes far more meaningful when paired with an actual reading from that same moment. Fourth, ask for a dedicated conversation with your doctor specifically about your blood pressure targets, not a rushed mention during a routine visit for something else. Bring your notes. Ask directly whether your current target makes sense given your age, your health conditions, and your activity level. Fifth, don't underestimate hydration. Many older adults don't feel thirst as strongly as they once did, which quietly leads to mild chronic dehydration. This can throw off readings and make your numbers harder to interpret accurately. Staying reasonably well hydrated, within whatever limits your doctor recommends for your specific health conditions, helps your readings reflect what's actually happening in your body. And sixth, give yourself permission to ask questions more than once. It's easy to feel like you're being difficult when you ask your doctor to explain a target number a second or third time, but this is your body, your independence, and your future quality of life on the line. A good doctor will welcome that persistence. If yours doesn't, that itself is useful information about whether you're getting the kind of individualized attention this stage of life actually requires. None of these 6 steps require expensive equipment, special training, or a medical degree. They simply require a notebook, a cheap monitor, and a willingness to pay closer attention to a part of your health that most people only think about for 30 seconds a year, usually while sitting nervously on an exam table. Here's what all of this really means once you strip away the medical language. Blood pressure isn't a single test you pass or fail at the doctor's office. It's a rhythm that plays out across your entire day and night, shaped by your age, your body's unique adaptations, and decades of wear that simply can't be reset by chasing a younger person's target number. The goal was never supposed to be the lowest possible reading. The goal was always supposed to be the safest, most stable rhythm for the body you actually live in today. You now understand something that took researchers years of careful study to uncover, and something that most people never learn until a fall, a foggy afternoon, or a dizzy spell forces the question. You understand that one reading in an office chair is a single frame from a much longer film. You understand that pushing numbers too low can be just as risky as leaving them too high. And you understand that the swings across your day may matter just as much as the number itself. That knowledge changes something important. It turns you from someone who simply receives a number and nods along into someone who can ask sharper questions, notice patterns, and bring real information to the people responsible for your care. That shift from passive to informed might be one of the most valuable things you take away from the next 20 years of managing your health. Think about how much of aging feels out of your hands, the parts of your body that simply do what they do, whether you like it or not. This is one of the rare places where you actually get a say. A notebook, a home monitor, and 2 weeks of honest attention can hand you back a piece of control that many people assume disappears the moment they turn 70. If this video helped you see your own numbers or a parent's or a partner's in a completely different light, that's exactly why it was made. Share it with someone over 65 who needs to hear this before their next appointment, not after. Like this video so it reaches more people who are quietly confused by the same conflicting advice you probably were before today. And subscribe, because there's so much more worth uncovering about how our bodies actually age, far beyond what fits on a single chart in a waiting room. Because in the end, the best blood pressure for you isn't the number that looks flawless on paper. It's the number that keeps your mind clear, your steps steady, and your independence firmly in your own hands. That's not just a target. That's the whole point. This video is for general educational purposes only and is not a substitute for personal medical advice. Blood pressure needs vary from person to person based on individual health history and current conditions. Never adjust or stop any medication without first talking to your doctor. Always consult a qualified healthcare provider before making any changes to your treatment plan.